Today's episode is with Professor Janki Andharia from the Tata School of Disaster Studies, which is located inside the Tata Institute of Social Sciences in Mumbai. Welcome, Professor Andharia.
Thank you.
So, today we'd like to speak about COVID-19, and we'd like to understand from you if COVID-19 can be looked at as a disaster, and if yes, why?
Certainly, I think COVID-19 is a disaster. And throughout history, uh, disasters have been depicted in the frame of social and political disintegration, and sometimes even collapse of civilizations. Um, Although disaster studies as such is an emerging discipline, disaster narratives have been integral to most cultures. So the idea of a disaster is something that definitely we need to look at a little more critically. And within that frame, then try and see why we would call COVID-19 a disaster. You have modern science that distinguishes between hazards and disasters. Hazards are individual events, could be earthquakes, could be cyclones. And when you talk of a disaster, you're looking really at the impact or the consequences of those hazards on society and on the environment. So the social and environmental consequences of a hazard event is what constitutes a disaster. So certainly we do see that COVID-19 has had a huge impact on society, has had a huge impact on people, their livelihoods, right from, let's say, the individual impact. If you look at the consequences, have been huge, completely devastating. It's also important for us to understand that COVID-19 has necessitated extraordinary measures, and it has created unprecedented cumulative and cascading impacts. So there's not a single sphere of our lives that remains untouched by the consequences of COVID. So the idea of a disaster I discuss in great detail in my recent book, which is titled Disaster Studies, Exploring Intersectionalities in Disaster Discourse, where one interrogates the notion of a disaster, the way disasters are written about, spoken about, essentially by technocrats and by scientists, uh, presents largely a partial picture. You don't get a full sense of what disasters are. There is a crisis oriented imagination which varies from one culture to another. And therefore, it's important for us to not just follow sort of instrumental rationality and look at disasters in scientific terms, which typically define disasters in a frame of disaster response and recovery and preparedness and mitigation, the classical cycle of disaster management. I think we need to go beyond that fixed notion of disasters. So I think there are different perspectives of understanding disasters, and it is useful for us to explore what are the ideological subtexts that define what counts as a disaster and what is left out. In fact, we often discuss, is poverty a disaster? We often discuss, is the levels of TB and death by TB in a country like India, is that a disaster? So I think there's more than what meets the eye when we look at disasters. The second point I want to sort of maybe flag here is that.
Go ahead. I wanted to sort of just extend one point that you made. So you're saying that what in normal life constitutes a crisis, for example, a cyclone, or let's say an earthquake, is not really the disaster, but what happens thereon, and which has cultural, economic, social, political consequences, connotations, all constitute the disaster and therefore the narrative around it.
Yes. Yes,
There's
because when you have, if you have an earthquake in the middle of an ocean and nobody is impacted, then you wouldn't call it a disaster, right? So, or you have landslides and avalanches all the time in, let's say, the Alps or in the Himalayas, but they don't become a disaster unless uh, society is impacted or the environment is impacted. So that's a differentiation we like to make with regard to the idea of a hazard and a disaster. So as social scientists, we would say we would call something a disaster based on the consequences of a hazard event.
And Rebecca Solnit says that the first thing a disaster teaches us is that everything is connected. To just stretch that a little bit, it also seems that once COVID happened, it led to a domino effect on society, especially in the way we responded to it. And it has both cultural and how do I say? It has roots in the way we've developed as a society. For example, the way the lockdown has been imposed, and the situation of migrants, etc. So what do you see as being exposed as a result of this disaster, um, given the fact that we are in India and the things that are unfolding around you? We've had people talking about migrants, but is that the only community that's been massively affected?
Okay, I think good point. Uh, we like to look at the fact that disasters typically reveal the underbelly of a society. And you cannot look at disasters in this clinical manner where you say that every disaster, the consequences are X, Y, and Z. So looking at the pre-existing conditions is extremely critical. Um, what does, let us say, what is preparedness of our public health system? How does COVID sort of what does it tell us about the preparedness of our public health system? So it is only when you are impacted by or you're sort of facing an epidemic or a pandemic that you begin to start looking at your public health system. And if your public health system is not good, you are going to be affected severely. So very often disasters actually test how robust your sort of social structure is, how good are your response mechanisms, how good is your infrastructure. So this is something that we often talk about. For example, when we were working in Bihar, we found that the records told us that there's a road from village A to village B. And when we went to to the village, people said there never is a road there. So on records, you have a road which is shown, but the road never existed. What does it tell you? It tells you that obviously there is corruption, there is a reporting of some work that has been done, but it never really was done. So corruption becomes an highlight. You begin to see that yes, this is a society where corruption exists. So disasters typically tell you about the underbelly of a society, and you have to confront it. Haiti is another example. What kind of inequalities exist is something that suddenly comes to the fore. If you have um, caste discrimination, you are going to encounter that discrimination in your response work. When you take relief to a village, people will tell you this is the spot where maybe the panchayat will tell you you will distribute your relief from X point and not from Y point. So I think some of these things, as people responding to a disaster, one encounters and one needs to be conscious of.
There is a lot of focus today on some marginalized groups, so to say. In your reading of popular narrative, um, what do you feel are areas that we are yet to look at or respond to, both in terms of immediate relief and um, opportunities to work on in, let's say, the medium term to the long term?
Can you just repeat the question? The first part, I got the latter part. But
Right. So there are a lot of relief. There is a lot of relief work going around with respect to a certain, vulnerability that has been exposed, which we see as migrant labor. But do you see certain exclusions that are glaring or gaping that you'd like attention on, that you would feel would be good to respond to right now, from whatever you've seen in popular narrative?
about specific groups you're talking about, or just in general?
Groups in general, spaces that you feel need to be addressed.
All right. I think if I were to look at it as, let's say, somebody who's a policymaker, the fact that we did not think of the impact of the lockdown on a whole range of people, in particular the urban poor. I'm just taking that as an example. Urban poor, I don't think we really thought through how the lockdown is going to impact on. So this definitely has been a blind spot, and we worked closely with different local groups in Mumbai. In fact, there is a project called the M East Ward Project, which this is a ward which has the highest number of slum dwellers, largest number of slums in the whole of the city. And while we were working with local groups, we found that there were a number of challenges. We had not thought through access to water, sanitation, food. There are so this is one aspect. The second aspect would be within populations, within urban poor, you have a number of categories of vulnerable people. Could be children, disabled, the aged. We've not thought through how we are going to reach these communities. So I think there are several such challenges which maybe as policymakers we need to think through. We also need to work much more on an integrated response. We also say that disaster management is a multidisciplinary and a multi-agency function. This coordination and convergence across departments is also quite missing. Another area of sort of focus would be to look at how are we doing in terms of decentralization. How robust is our local self-governance? One of the reasons why Kerala has done so well is because of its success with decentralization. What is the situation on these aspects? In the city, do we have ward committees? How robust are our grievance redressal mechanisms? I think these are questions that we need to think through, and we probably need to institute many of these institutional mechanisms when we are looking at COVID response. I mean, I can go on and on about many such gaps that exist in a context where 90% of our country's labor force works in the informal sector. The fact that they work in the informal sector means that they're not necessarily captured by your, say, social protection schemes. And on another side, you have each of our social protection schemes that are not risk informed. If you look at how we plan and program our welfare programs, we find that for a country where 85% of the landmass is prone to one disaster or another, our social welfare programs are surprisingly disaster blind, which means during disasters, each of those schemes need to ramp up. However, because there's no guidance, there's nothing in the scheme, they typically tend to be, you actually shut down because you don't know how to reach those schemes to the people. So there was this study that we did recently, funded by UNICEF. It was a national study where we were really looking at how risk-informed are our national flagship programs at a national level. And we find that except for Manrega, all the schemes and all the programs are disaster blind. Now that is really shocking. So there's a huge need for us to retweak or re-engineer our social welfare programs across different line departments and see how we can make them far more responsive to the disaster context in which we find a large number of our vulnerable populations struggling.
So, for our audiences, I'd like to say that if there are any questions, you can put those questions up on YouTube or Facebook, and we'd be happy to put those questions to Professor Andharia. So, Professor Andharia, you said that none of our programs except Manrega are risk informed. Could you illustrate what you mean by that? Could you cite a couple of examples which could help us understand this?
Okay, let me take food security, and this is directly linked with our COVID response. The Food Security Act mandates that the PDS system function in a certain manner. However, within the Food Security Act, the only reference to disaster is a clause which says that during disasters, all the provisions may be suspended, instead of actually saying that during a disaster, the standard operating procedure would be A, B, C, D, E, F. So that's one example. The second example would be, let's say, the Swachh Bharat Abhiyan, the building of toilets and hand pumps in places, let's say, flood-prone Bihar. You would find annual flooding. However, your guidelines with regard to toilet construction or hand pump construction in flood prone areas should incorporate maybe 5 points which say that if you're building toilets in a flood prone area, you need to be elevated by maybe 3 feet. So there are design recommendations you could make. Similarly with hand pump, because what typically happens is as soon as there are floods, you find that the toilets are underwater, the hand pumps are underwater, and that creates a whole sanitary crisis. So I think these are simple things which are completely doable. In the recent Kolhapur floods, I was at a meeting and we were discussing some of these issues with the government of Maharashtra line department heads, and we were discussing the fact that all your electricity meters are at a low level. Can there be a guideline which says that in XYZ areas, you just take the meters up on maybe the first floor? I think these are simple sort of aspects which can be easily incorporated. It's just that no one is thinking this through.
So it is terrifying to hear that at times of a disaster, the act says that food supplies will be suspended because
not will be suspended, may be suspended, because you can't reach. I mean, it's looking at it from the perspective of the guys who are delivering your PDS. So I mean, I think there is a huge sort of need for us to what we call risk inform our programs and our planning process. You should not be, for instance, allowing construction in low-lying areas. So I think these are guidelines. It's not rocket science, but with a little bit of application, it's possible for us to get there and reduce the extent of damage to property because the losses are so humongous.
So I want to shift attention to the fact that this is not the first time that India is facing an exigency or an emergent situation. We've been a country, like you said, 80% of our land mass is risk prone. We've had many disasters, and you've been a responder to many disasters since the Latur earthquake. Given our responses both to public health emergencies in the past and other disasters, are there any lessons to be learned that we could apply right now? Is it possible for us to look back and say we did some things right, and it's time to draw upon those learnings and convert them into action?
I think many of the examples that I gave you were about these kinds of lessons that we've learned, but certainly we definitely need to sort of work in closer coordination with community-based organizations, self-help groups, the corporate. I think that's something that we really need to institute in every disaster. In the Gujarat earthquake in 2001, there was an NGO coordination committee that was formed for the first time. So that's an interesting model that just as you set up different kinds of task forces, you could have one bureaucrat who's made in charge of NGO coordination. So that would be a useful practice. Many states do follow some of these practices. We could also sort of look at, as I was saying, in Kerala, you have the Kudumbashri. Yeah, it is a parastatal entity. It has played a very key role in providing food through community kitchens, and they have been very active even during COVID-19. So the Panchayati Raj institutions, as I was mentioning, are the ones that really where we need to build a lot of capacity in this country. In fact, I was talking to a junior disaster management specialist. I mean, that person was someone who is trained in disaster management, has a degree, and works in one of the states. And he says that the capacity of our officers in just understanding disaster management and what is required is so low. So while we talk about a paradigm shift at the national level, we love to talk about the fact that we are not response centric, we are more sort of geared towards prevention. That's not quite true. We tend to be response centric, and that's part of the problem. So when in a disaster situation, when these so-called specialists try to educate or say, these are the recommendations, this is what we must do, there's so much of frustration because they say, I mean, like he put it, he says it is like reading the Gita to a donkey. So it's that frustrating to see that proactive measures, lessons learned from other disasters, when you try and sort of insist that they be instituted, you find. So what needs to be done is not something at the time of disasters. We need massive amount of training and awareness building prior to the disaster across all line departments. So I think this is something that, I mean, again, just to build on that, there is a middle class understanding or a commonsensical understanding that disasters affects everybody equally. And nothing is further from the truth. So how would you educate people to say that it's not just it's not true that everybody is affected equally, and therefore you reach relief only to those who can be reached, and then you leave out those who are truly in need, those who are really what we call the last mile. Now, this understanding that you need to start your response approach with the last mile is a strategy that needs to be instituted. And this would happen if everybody is aware that, yes, a disaster can actually impact the poorest the most, is an awareness or a sensibility that we need to develop and move away from the middle class understanding that, oh, everybody is affected equally and it's the wrath of God and, such like, uh, uh, these are sort of impressions that we carry and we feel that that is so. So I think when we talk of professionalizing disaster management, these are some of the operational aspects that, and I think there are states which are working hard. Orissa is working hard. Bihar, with all its challenges, is working hard. And unfortunately, we find that there are some so-called wealthier states that we find wanting in many of these aspects.
So the pandemic is not the great equalizer, like you're saying, because that seems to be the narrative that's building, that this will equalize everyone. And clearly, based on experiences, it seems like it is affecting different people differently. We have a bunch of questions coming in from viewers, and I thought now is a good opportunity to ask you one of those questions. So the question that one of our viewers has is that this pandemic is different from past disaster management techniques, as here we cannot collaborate physically. Would you think technological infrastructure is useful, and what would be its degree of utilization?
Certainly, I think indeed when we keep using this word unprecedented, it's a reality. I think this is something no one ever could plan for. However, each disaster, including the pandemic, actually demonstrates that we are caught napping. It is very, very well known that India spends, let's say, I don't know, less than 2% on healthcare of so less than maybe 2% of its GDP on healthcare, whereas more developed countries would spend anything between 10 to 20%. So the fact that we are not prepared, the fact that before the disaster, our healthcare system is not accessible to a large chunk of the poor population, I think there is something that we need to think about. Now, the question is, so you can't overnight, I mean, China did it, build a hospital, but I don't think India is in a position to do stuff like, build overnight hospitals across the country, across every ward, and so on. So I think India is trying to do its best by roping in the private hospitals. In fact, just today we had the Mumbai Municipal Corporation issuing a whip of sorts to the private hospitals such as Breach Candy, Bhatia Hospital, Jaslok Hospital, which had shut down because the nurses and some of the doctors were affected by COVID-19. So they have said that they have to reopen and they have to sort of provide services. So I think these are aspects that we cannot overlook. And whether it was COVID-19 or whether there were mass casualties, certainly I think the public health infrastructure is wanting, and we do need to do more in this area. Now, to the second part of your question was whether technology can help. Certainly, I think technology can help. If we look at some of the countries like South Korea, they have used technology extensively for tracking purposes. Does India have the wherewithal? Can India get there? I think it is possible. And one of the things I should share, what TISS is doing is mapping in M East Ward essential services. So we are sort of looking at where are the nearest hospitals, where are the nearest Dawai centers, where are the community kitchens, so that when we do get calls, we are also running a facility called iCall for psychosocial support and so on. So when people call us, these are things which we can readily provide. But this is like a very, very small effort. So the question is, why can't the government do this? Yeah, or why can't the government partner with private entities and provide some of these services? Because I think many people they do have mobile phones, they have smartphones. So yes, I think technology can certainly be used. And I should share that many of our students and alumni who are working from home are in touch with our faculty, and faculty and students are doing some wonderful work in this area of trying to map and make something available, make it available in a vernacular language and so on. So yes, technology can play a very important role, but the government also needs to see. Our challenge in this country is doing things on scale. So unless you integrate an idea within the governmental frame, the impact is going to be limited.
So without cooperation from the government, it's impossible to be able to solve anything, especially given the wide-ranging effects that COVID has had on society. There is another question. This is from Emmanuel from the University of Copenhagen. And he asks that, given the current political and social situation, how do you see that our response does not compromise rights and dignity?
So the question would be, who is to ensure, right? So I know where Emmanuel is probably coming from. The reality, see, I think we need to recognize that all humanitarian response happens in a given context. And the context is always deeply political as well. So just as there is a social context, there is also a political context. So to respond, certainly there are serious challenges, and we know that there are a number of groups, journalists, activists who are trying very hard to ensure that we are able to uphold the rights of all the citizens as enshrined in the Constitution. Not an easy task, but I think there are people working hard on that.
The next question is on the impact that has happened on the social sector because of this. And by social sector, the government social sector, such as ANCs, MDM, anemia, malnutrition related programs that were running before COVID have massively been impacted. What do you suggest could be a mechanism for recovery in order of priority? And how could we use these to sort of lessen the impact of the disaster?
Yeah, I think that's a very sort of interesting question and a very valid one, because this is something that we need to ensure that people don't fall off the radar in terms of whatever programs that were ongoing with regard to anemia, nutrition, malnutrition, and so on. I think what the government is trying to do is to recruit volunteers. So that's one strategy which is useful. The second suggestion would be to these are areas where we can use technology very effectively. All it needs is maybe a phone call to say, have you taken your medicines? That is assuming that those medicines have been reached. So if access is an issue, then we need to fix that through mobile sort of systems. But sometimes you need someone to say that, okay, you need to take those medicines as well, whether it is for TB or whether you're part of the DOTS program or for anemia and so on. So I think these are areas where technology can help. We need to have sort of helplines for each of these programs, and it's completely doable.
So clearly, there is a need for overarching infrastructure to be able to respond to this disaster. Um, there is a question on the role of Panchayati Raj institutions that you've covered, but apart from training them or bringing in some awareness, how could one actively involve them in responding to this disaster? Um, this is also, I think, because for years our local self-governance systems have been burdened with the bureaucracy. I think it's an even more pertinent question right now. How do you engage them? Given the example of Kerala, also, do you see any other states which are able to do this in an effective manner?
This question really also pertains to the point that was made earlier. If you have a robust Panchayati Raj system in a state or in a particular district, the chances are that they will respond well during a disaster. But if you have a Panchayati Raj system, or if you have a governance system which is weak before the disaster, to expect that they would suddenly sort of respond in the ideal way is something that is not going to happen. So, however, that doesn't mean, I think every disaster is also an opportunity to sort of institute good practices. So, if we do create systems whereby you have, let's say, an SOP, or make sure that every panchayat is responsible for XYZ and ensure that that's done, I think it's possible to sort of. In Kerala, what you see is that every panchayat uh, is responsible and accountable for everybody who lives in their sort of within that village. So I think that kind of accountability needs to be instituted as well, along with the powers that are technically speaking granted within the panchayati, within our local self-governance system.
I want to go a little above the Panchayati Raj system. There is a lot of news coverage, and there's an unprecedented use of this National Disaster Management Act and the Epidemiological Diseases Act. There is some kind of enforcement of a lockdown from the center, and there seems to be some encroachment on the center-state relationships, as is in normal circumstances, and there seems to be a lot of friction even at that level. Uh, you were part of the consultations that ultimately led to the creation of the National Disaster Management Act and some of its state-level predecessors. Did you imagine that the act would be used in such a manner, and what is your response to this kind of usage of the act?
Okay, let me sort of first of all clarify that I do think that having the National Disaster Management Act of 2005, I think it's a good piece of legislation, because prior to that, and believe you me, we have worked without a framework until 2005. The framework that we had was the famine code and the relief codes, which were like 19th century. So I think having the Disaster Management Act was certainly useful, and it's good that there is a framework. Now, the Disaster Management Act it actually overrides everything else. I mean, all the other acts, for instance, Gujarat had an act prior to that, but the 2005 Act at the national level overrides that. The question of at the federal level, should there be these kinds of powers which compel the states to do ABC? And I think, technically speaking, yes, those powers should be there. However, the question of balancing those powers is very critical. What we find, and I think again I would like to sort of generalize this, that every disaster is always, whether in India or abroad, a battlefield of politics. I mean, you can't keep politics out. If you believe that, well, all disaster response work is humanitarian in nature, and it's just the feel good factor, or the idea that people want to do good, is not necessary, is not true at all. So politics is necessarily present when you're doing humanitarian work. So now, applying that idea to the center and the state, yes, I think we are seeing that there is an inter-ministerial central team that's coming to Maharashtra, that's going to another state. We also see that despite the brilliant work of Kerala, the government has sort of sent them a letter saying, ticking them off and warning them, saying that they should not be lifting the lockdown down that early and so on. So I think how much of it is needed and how much of it is politics, it would be difficult for me to say, because I'm not 100% familiar with everything that's happening within each of those states. So in fact, I was wondering how the ministerial team is going to travel from Delhi to these states, because the airlines and the trains, none of that is working. So
clearly,
I'm wondering whether we are going to have chartered flights on the one hand to get into this, or are we going to do a Zoom visit? I have no idea.
So, well, it's not business as usual for most of the country. It is business as usual for the politicians. There are several countries that have responded positively to this disaster and have been able to contain it, whether it's South Korea or whether it's Singapore. And of course, while these are smaller countries, there are elements of these countries that, elements of their response that have been praised, that have been recommended. In your understanding, what are some of these things that could be implemented easily in India, which we may not have done yet?
I think in India, nothing is ever easy, because we are such a large country. So can something be done easily? No, I think things can't be done easily, because we are also trying to address a whole wide range of gaps or the lack of many things. So I think that's one of our major challenges. The other challenge, of course, in India is the interdepartmental work. If you recall, we started uh, the response through the health department, and it was entirely seen as a public health emergency. So it was the health department driving, and the entire focus was on looking at the health infrastructure. We did not look at all the other sort of social sector schemes and programs and so on. In fact, that was a time when I spoke to several disaster management authorities, and uh, they initially said that they were completely on the sidelines. So I think this interdepartmental coordination is something that is absolutely critical. Um, Something that I think this is a matter of much debate in the country about testing. We do need to test more. If you look at South Korea got where they did because they aggressively tested, they were aggressively tracing, and they were treating. So that was their model. And they were able to sort of follow through with all of this because they had the experience of MERS about, I don't know, 6, 8 years ago. So there already was a certain amount of experience, and South Korea built their model on the fact that their treatment facilities were excellent. Uh, they also have the highest proportion of cashless transactions. So digitally tracking people was easy for them. So they were able to flatten the curve. They've also had the highest number of phones in the world. So, and I think they also have uh, you know the density of use of technology is very high. So I think South Korea is an example, certainly, but what can we uh, emulate from South Korea or Singapore? I'm not so sure we can readily lift any models, but certainly in India we do need to test more, is what all the sort of medical fraternity seems to be saying, and I think that's something we might need to do.
So,
Education, awareness. We need to set up more shelters, more relief camps. I think our issue is also going to be density of population. So being able to work around these challenges, particularly in urban centers, is certainly a challenge in our country. But we will need to work more sensitively and more strategically on some of these matters.
there are a couple of more questions that have come in. One is quite interesting that this is an elite disease, and in that context, how do you see disasters and globalization and the negative effects of globalization on disasters?
That's that's a very large question, and yes, it is true that it is an elite disease, and we do need to ask this question: that why is it that the poor are paying the maximum price for this? I think it's a very important question. Um, Linking globalization and disasters. I mean, I think it's like I would need to give a treatise on that. I don't want to get into this whole discussion because, yes, there's a brilliant book written by Naomi Klein on disaster capitalism, The Shock Doctrine, which I think is a good read. So I would recommend whoever's asking this question that they should read this book. It talks a lot about how uh, during disaster times capitalism flourishes, but this is a real interesting context now where the entire sort of world is likely to go into recession. So I think there are real challenges out there, but there are also opportunities for countries like India where we can aggressively get into uh, more of production, more of self-help, smaller units, and so on. I think there is a real opportunity for us out there.
So it is the time to leverage our capacities to the maximum possible limit, and it is also the time to come together. So a lot of our speakers in the previous webinars have spoken about solidarity and how that this is not a problem for 2% CSR. This is not a problem that the government can solve or one system alone can solve. So I'm just reframing one of the questions that's come to ask you. How do you see, you've mentioned integrated response a couple of times, but how do you see society coming together? Is that something that can happen as a nation? Should we try for more localized models? And what forms in which are there in which we can come together? We can see some collaboration in civil society in different states. In Karnataka, we have a COVID-19 collaborative that's built up, but that's not enough. Obviously, civil society can only do so much. So what is your view on this?
I think, yes, certainly we need to come together. And I think as a country, we have a very rich pool of wisdom, great ideas, plenty of initiatives, and a very willing corporate sector, which is sort of happy to help and support. Our challenge is that we need to, and this is the way I would sort of think this through, we need to look at, we are very good with immediate response. So people come together, civil society comes together, and we are constantly sort of saying that, okay, so many meals required here, this is where we need a medical team, or, however, to use now to kind of look at the context and work on a long-term strategy or a middle-term strategy and then a long-term strategy requires going to the drawing board and working very systematically across sort of pools of people who would be able to help strategize, because it's not an easy it's not something that one department or one entity can sort of suggest. So I think if the leadership comes from within governments or even within corporates to say that we are now working on a strategy at the level of, and I know that there are some initiatives which are looking at how to revive the economy, but we need similar sort of processes which look at the poor, the agricultural laborers. I mean, for example, there was this very interesting suggestion made by P. Sainath that we need to now ensure, now that's long term thinking, we need to ensure that we work much more on, make sure that we work towards more of food grain production. Now, because your trade is going to be affected, you don't know what's happening in other countries. So make sure that you are encouraging farmers to shift from cash crops to food grains. Now that's long-term thinking. Are we able to, work on ideas like that and then how to operationalize it? So I think the uh, collaborative thinking is absolutely necessary, but it's again something that needs to happen at a higher level, at a policy level. Another thing you could do is throw this challenge to maybe young students or younger people. I mean, there are ways of doing this, and it I think if the government is able to sort of look up from its immediate response, because right now they are overwhelmed with the response, and there's obviously heavy reporting that needs to be done, there's data gathering, etc., etc. So it requires, I think, a different kind and different level of thinking at the country level, and certainly possible. This is again an area where I think like-minded people, even from the private sector, the corporate sector, need to come in. I mean, I just give you a very simple example. We have been struggling with our supply chain management. This country has sort of brilliant logisticians from sort of international, I mean, you have, let's say, global pharma companies and so on who do brilliant supply chain management. Now, why is it that we are not able to use the wisdom that exists or the practices that exist in the private commercial supply chain and apply it to our, let's say, PDS and all these various systems? It's not so difficult. So I think there's tremendous scope for us to work on partnerships, build on partnerships at multiple levels.
So TIS is uniquely located in the M East Ward. You're in Devnar, very close to Govandi, very close to Mankhurd, parts that have been most deeply affected by this disaster and will continue to reel from the pressures of this situation. Could you tell us what you've been doing in response to COVID-19 yourself, and what TIS has been doing as an institution to respond to COVID-19?
Thank you for asking that question. Yes, I think TIS has been sort of working on various fronts. I should also mention that we were actually at the end of our semester. We were working on, people who are familiar with our rhythm. There were research thesis submissions of students. There were vivas going on. There was assignment correction, etc., when this happened. But through all the challenges of the lockdown, and I think it is true that we can't be physically going out because of the issue of mobility, but we have had students and faculty and alumni who have been working at multiple levels. At M East, we've worked hard to get community kitchens started. In the initial days, ensuring that ration was reaching the homeless, ration was reaching certain pockets of M East was a huge task, and our faculty members worked consistently, persistently on these issues. We have a facility called iCall, which is catering to the psychosocial needs of anyone who calls in. We are now trying to integrate the iCall facility with other kinds of response as well. So it's not, we're trying to look at mental health response along with psychosocial care. So it's really like being able to provide multiple uh, multiple responses through that facility. Um, we've also been working on policy documentation. We've been giving policy notes to the government. And I must say that the government has responded very, very positively to many of our suggestions. We had sent a note to the NDMA. They have further shared those notes with state governments. So I think we've been sort of the long-standing work that we've been doing gets visibilized in these manners. We also have faculty members who are working on what we call best practices. Small, simple things are being documented. So on a weekly basis, there's a little note which talks about what is going on in maybe a small pocket. So good practices which we would like to share, and that's done in Marathi, Hindi, and in English. So that's another small initiative, but we think that these small initiatives do have a larger impact for people to sort of emulate. Then our School of Media and Culture Studies has brought out specific videos again in Hindi, which talk about simple things like what is the difference between isolation and quarantine. There's a lot of fear amongst people in the community that we are being taken. If I report my fever, I will be taken away somewhere and I don't know. So the police will come and take me away. So I think some of these myths which people have, so addressing some of those, they've made films. So I think there's a fair bit of work, and we are only looking to scaling that work further. And we would welcome any of our alumni or anybody else who wishes to volunteer or partner to join hands. There's a website that should be live in another 2 days, so which will give a clearer picture of all the work that's happening. The Hyderabad campus is producing policy briefs. It's called Policy Tracker. So those are also available on the website. So yes, I think great work. This has a legacy of doing disaster response work. So we all sort of uphold that legacy, and proudly so.
Thank you so much for that. It seems like there are a lot more questions coming in, so I'm going to filter some of them and try and ask as many as I can. Are there any thoughts on amending the National Disaster Management Act to make us more accountable and making us more prepared? For instance, action taken report on decisions taken every year.
My thoughts or other thoughts? I think there is a lot of work happening on the Disaster Management Act, and it is up for revision. So yes, there are several sort of suggestions. There was a consultation that was conducted. I think it was in 2013, and there's a report as well. So, but the feeling also was among some of the legislators was that it was too early to amend an act which was just made, a few years ago and so on. So, but yes, I think there is definitely um, a lot that needs to be done with regard to um, accountability as such, not just disaster management authority, but I think accountability per se in a country like India is an area that needs tremendous amount of work.
Okay. Do you think pandemics will become a part of legislative action, given that so far they were not defined as disasters?
When you say pandemics, are you?
So
I think it would mean what happens. Yeah.
The assumption is that such events are no longer black swan events, that they will keep recurring. You will have epidemics, pandemics. So would you recommend that this becomes part of legislative action? This become part of acts and rules and policies? Because in India, the very lens of disaster is again an earthquake or a flood or a cyclone.
If you look at, the National Disaster Management Authority has brought out guidelines about how to deal with some of these situations, minimum standards of relief, and so on and so forth. So I think typically it's only after we have experienced something that there is a ramping up of our systems. I mean, that's historically, whatever number of guidelines or rules and regulations you may bring, it is only after a state experiences a massive disaster that it sort of wakes up and says, yes, we need to do something about it. So maybe this is one of those sort of situations where we will become far more cognizant of the fact that any kind of epidemic requires maybe 10 things in place. So this would probably be a good lesson for us to ramp up.
One final question before we close for the day. There's been a massive increase in the number of domestic violence calls and cases during this lockdown, and what are your thoughts on that? And should that be included in some form of policy making, some form of, again, included? Could we have some learning from this, which we could use in the future?
Certainly, I think this has been a matter of great concern and a subject close to my heart as well. I will share with you very honestly some of the conversations that I've had with the sort of NGOs that are working in this area, or the special cell, police, and so on. It's what I have been told, and I think again there is some merit in that. Indeed, we need to do things. Indeed, we need to have a response. How effective would that response be? I think these are questions. But with a very heavy heart, one has to say this, that if your services were so grossly inadequate, even during sort of non-lockdown times, in lockdown times, what do you actually do is really a very important question. I mean, you may offer some kind of counseling, you may offer certain kinds of strategies, but yes, it is a reality that you suddenly have the perpetrator of abuse right there 24/7 in front of a child. So if there's child sexual abuse, how do you deal with it? If there's domestic violence, how do you deal with it? I think these are real questions, and I do know that there are several people working on, a more robust sort of a response. Do we have like a response which will eliminate domestic violence? Definitely not. But yes, we need to sort of work on these areas closely with the police. I think again the police are overworked, and for them this is really not a priority. So I mean, I think we are dealing with several sort of challenges here. So my answer really is that I don't have an answer.
Thank you so much for your time. We still have questions coming in. We'll find a way to reach, make sure those questions reach you. Thank you so much for this session. Thank you, Signable, for coming in and translating this session in sign language for us. This is part of a session series of webinars that I'm doing in partnership with Egomong called On the Front Lines. You can log in every weekday till the May 5th from 6 to 7 to listen to insightful conversations such as this one that we had with Professor Andharia. Thank you once again.
Thank you. Thank you, everybody.